Hello and welcome, or welcome back. My name is Kabira, and this is my channel, Kabira Speaks. Alright, so I've had a channel, a YouTube channel, if you will, for some time. Hi, Myra. My puppy's here. Come here. Good girl. This is Myra, my daughter. Thank you. Okay, I've had a channel for some time, and when I first started, thanks, Myra. Um, when I first started, I talked a lot about my mental health because I was really struggling for some time. And it's been a while since I spoke about it, and I thought I would give an update because a lot has changed for me. Um, and yeah, I just feel like I kind of need to give a little closure for how things ended up for me, like mental health wise. Not ended up because it's always a journey, right? But just, I guess, how things are now. Um, yeah, so I'm glad to say things have gotten a lot better for me, like in regard to my mental health. It was really challenging there for some time, and yeah, I honestly didn't even think I'd ever make it this far, but here I am, so I'm glad to be here. But yeah, I had shared a bit about my mental health journey when I was pursuing like getting diagnosed. I knew I had some functioning problems, so I was looking into a psych evaluation for like potentially ADHD or just figuring out whatever it was that was the cause of my functioning problems because I was really having a hard time in many different aspects of my life, like maintaining my a job, um, finding and maintaining healthy relationship with myself, for example. So like major aspects I was really struggling in for some time. So I had sought out a psych eval and I shared a little bit about that process on my YouTube channel. I shared about taking Lexapro for depression and Abilify for bipolar 2 disorder. And haven't really spoken any more about it since I shared that I was like first diagnosed. Um, so yeah, I just wanted to take some time to do a little recap today, do a little update. Um, yeah. So where shall we start? Um, on my porch. Hopefully that the volume is good here. So I am 31 years old. I just turned 31 last month, and I had a lot of self-loathing when I was younger. When I was a preteen and a teenager and a young adult, I had a lot of self-loathing, um, and a lot of anxiety and depression as well. And I would engage in self-harm behaviors like cutting. Um, yeah, that's just kind of what my like youth was like. I did have a lot of protective factors that I'm really grateful for, like um my drama club. When I was in around 8th grade, I started doing public speaking competitively, forensics, you may know it as. Um, and that's where I met a lot of really good friends, people that I really honestly consider like lifelong friends and family. And it also helped me find my voice and my confidence in a lot of ways. So that was a major protective factor for me. Um, I found something that I was good at. I found people that cared about me, like my peers, and then I found some adults who also cared about me through that. So that was hugely helpful for me in just like protecting me when I was young. Um, as I was dealing with those problems, like feeling really depressed, feeling a lot of self-loathing, feeling a lot of social anxiety. I think my first video I ever talked about on YouTube was how I um, was adopted and grew up in a town which was primarily Caucasian. um, there was only there were a few other students of color in my class in my school, which it did like have an impact. Um, it certainly had an impact on my self esteem. Like for a long time, I thought I was unattractive and undesirable, unworthy, and there's a lot that is going into this. Yeah, so that's kind of like what my teenage years looked like a bit, and I'm skipping and breezing past a lot of this because uh, one thing I've realized is I do always want to be very candid and honest. And when I first started on speaking like in a vlog type of way, I thought like I had to bear all in order to be totally candid. And I still want to be totally candid, but I'm realizing like there's some things that I should probably keep to myself. So I'm breezing and skipping past my youth, but just letting you know like I struggled. I was sad. Had a lot of self loathing. I engaged in self harming behaviors. And I felt like I didn't fit in a lot of the time. I did have people that I know that loved me. I had a really good friend group and stuff. People that I'm still friends with to this day, some of them. Um, and for that, I am truly grateful. And even the people that I'm not friends with to this day, I'm still grateful for them. Still grateful to have known them and for the memories that we shared and for growing up together and all that. Got a little coffee here tonight in my favorite strawberry mug. Um, yeah, so I would say that I had like a lot of good and happy memories growing up. Like I went to a public school. I was very involved. I was I used to be religious, so I was very involved in my church back in the day, and I was very social, and that all of that I loved. But underneath, I had a lot of mental health problems, and that followed me to college. So at first, I went to a university in my hometown, Keystone College, for a couple years. And then I went to a different college called Mansfield. I'm not gonna get into all of it tonight, but not long after I was at Mansfield, I was assaulted. I was sexually assaulted. Um, really shitty, tragic, fucked up. Um, yeah, I just got in my own apartment on my own. Um, and I was assaulted, and it totally like changed my trajectory and majorly messed me up for a long, long time, as you can imagine. Um, I will do a separate video on like the assault because it's another topic I had started because a few years ago when I was going through the process of reporting the person who assaulted me, I spoke about it on my channel, and I wanted to do an update on that as well, but I will sort of keep them separate. However, they're colliding at this moment. Excuse me. So I will just briefly tie it in. I know it's like super triggering for me to talk about. I'm sure it can be triggering to hear. Um, so I'll keep it brief. But yeah, that happened when I was a junior in college, like right after I got there, I was so excited to be a new student. Like that's all I wanted was to be a college student at, like and be away from home. Um, yeah, so it happened pretty quickly after I became a student, and I tucked that away in a little box in my brain. The brain has a tendency to do that. Put it way far back in the recesses, and I went about the rest of my 2 years of my bachelor degree, and I was seriously messed up, like um, crying spells, helplessness, feeling worthless, uh, fe- suicidal ideation, like um, very severe symptoms. But I wasn't, because I had tucked that whole thing that happened to me back away. I wasn't like attributing it to that, and I just thought it was sad. But I did manage to get my bachelor's degree in social work. Oh, I don't know if you're picking up on that little howling over there. It's okay, Myra. It's okay. Um, yeah. So uh, that happened to me. I had like some eating issues throughout college. Um, I ended up going to grad school, and I I will say I unfortunately had like a what do you want to call it? A trauma bonded relationship with the person who had assaulted me. So that person was in my life for like 2 years after they had assaulted me, and I didn't end up reporting it for several years later. But um, so I graduated from Mansfield with my bachelor's degree. I moved to Westchester to start getting my master's in social work. And I was away from the person who had assaulted me. Still hadn't really like confronted it yet because it was still tucked away, like memory wise. And that's when I met my next long term boyfriend. I met the next person I would date for like the next several years intermittently. And this person I really fell in love with. But I think they were really like harmful to me, and I didn't see it for a long time until like I could really look back and be like, wait a minute, that's kind of weird that they would say that to me, be that way to me. But at the time, I could not recognize when someone was harming me, for the same reason I had stayed with the person who assaulted me for 2 years. It's really unfortunate, and I don't blame myself for it because I know now that it's like a response. And I've grown a lot since then. But long story short, I was with someone for several years, on and off, who they they didn't uh they never hit me, they never threw anything at me, but they would like throw things around me, raise their voice around me, and just cut me down, like death by a thousand cuts in a way. And I love them so much, or I thought that I loved them so much. It Looking back, that also kind of feels a bit of like a an unhealthy bond. Um, so this all came to a colliding point, I suppose. That's about a bit of the history of like the timeline. The assault, graduating my bachelor's, graduating my master's, meeting that other person. Um, all along that timeline, I'm dealing with like depressive symptoms, social anxiety, um, self medicating by drinking, and there were a few attempts that I had made to help get help. When I was assaulted, a friend of mine, Sarah, did encourage me to make a report. Um, so I did speak to one counselor at my college, Mansfield, and it's something I'm really like kind of angry about because they did not I feel like they didn't help me. They didn't I told them what happened, and the person didn't she just let me go on with my day. She didn't I don't think she did due diligence. She's the only adult that I told that it happened. So that was one of my first attempts to get help. Um I think when I was in grad school, I went to counseling again. At that point, the assault was like tucked away in my brain, so I didn't wasn't bringing that up. I was just bringing up like maybe how I was feeling or how whatever. I do remember feeling like I can't be totally honest with this therapist because I want them to like me. I need them to like me. That's how I felt at the time. Um, Finished grad school, started working, had trouble in my first few professional jobs. I had always been working like throughout college and everything. But when I like graduated college, that's when I really started struggling in my work life. So I was like getting demoted, losing positions, not being able to keep up with the daily functioning. So I had been thinking, it, Bug, do I have do I have ADHD? I don't know. I've always had like a bit of a scattered mind, a hard time being on time, um, like different challenges that I thought possibly I might have ADHD. Um, so I ended up making an appointment with a psychiatrist. I think I was just initially starting the psych appointment for to treat the depression. So I had around the time that excuse me. So I had a counselor here and there when I was in college. I didn't find it all that helpful. Then I'm out of college. I'm struggling in my adult life. I again seek professional help. The year is around 2020. I moved to Delaware from Pennsylvania. I had been working as a mobile therapist. Needed a break. I called it a break. So I ended up leaving my job and like going to bartending school. I wanted to be a bartender. I worked at Chickies and Pete's as a server because they wouldn't hire me as a bartender. And then the pandemic happened, and I still have never worked behind a bar. But yeah, after that, I had a few other jobs, and I just was struggling, which is what prompted me to seek an evaluation, seek help. So, unfortunately for me, the doctor that I had was really terrible. And I'm still upset when I think about it. When I have her paperwork here, it literally upset me so much just to reread it and to think about it today. But it is part of the mental health journey that I have been on. So, um, yes, I moved to Delaware 2020. It looks like my first appointment with this psychiatrist was 2021, November 2021. So I've been living with my uh, ex for a couple years, and just the way she talks about me is so. And I'm someone who writes progress notes for a living. I also have to do this. I don't know. It's just so condescending for me. And also, a lot of the things that she said were just simply not true. And one of my complaints was that she was not listening to me, and it's like it's so clear she wasn't listening to me. It's very upsetting. It's just like this is my life, bro. Can you try to take it seriously? She feels she was abused. It's like the language is very. So, based off of this first appointment that we had, which I'm sure lasted probably 40 minutes, this doctor based everything from then on about me. So, I think I mentioned, yeah, she has a history of heavy alcohol use. She denies street drugs. She wonders if she is bipolar. So, that was our first appointment. Notes, horrible. So my first appointment with the psychiatrist was November 18th, 2021. And keep in mind, at this point, I'm like, as I'm sure maybe you know, it's like it's hard to take off. You have to take time off work. Probably wasn't having paid time off work at this point. Um, yeah, so I'm like losing money to go to the doctor, and I just felt like a horrible waste of my time, like being misunderstood, misrepresented. But let's go to the next appointment. So the first one was November. The second one was February 17th, 2022. Patient seen in office for medication management for anxiety. This was a scheduled 3-month follow up, but she says she called to make this appointment to discuss ADD. I remember that. It was like a miscommunication or something. I thought that this psychiatrist could evaluate me for ADHD. And when I got there, they were like, "What the hell are you talking about?" Which was like very upsetting. But she says she called to make this appointment to discuss ADD. And that's your first clue that this doctor is not like present because it's called ADHD now. She has never been diagnosed with ADD but thinks she has it. We discussed multiple reasons for inability to focus and concentrate, and I would like her to see a therapist, as we had discussed previously, in order to clarify this. She did call Serene Minds, but got a message saying they are not taking new patients. I gave her the number of behavioral health. She thinks the Lexapro helps her mood, but she's still anxious and wants a therapist who specializes in, because she says this is what she has. She denies suicidal ideation, she sleeps well, her mood is okay. She is moving to her own apartment and she is looking forward to this. She's drinking much less, but still drinks several nights a week. And that's it. That's all that she said. She didn't say what she would do for me or recommended. So I guess at this point I have been taking Lexapro for some time, and I did find, like I said, I did find it helpful. I guess my mistake was, yeah, trusting this pr- psych to give me more than just the medication. I guess I don't know. I don't even want to say that. That's why I was even struggling to come on here and talk, like because I was so angry at this person because I really feel like she mishandled everything with me. But I don't want to say that like as a whole for psych provider because it's not always like that. It shouldn't be like this. This person just really messed up. Okay. Yeah. So this person was like really insisting on therapy, which it is important, like if you are on medication to do therapy at the same time. But at the same time, like um I was not making a lot of money and I had limited resources. And this doctor was like, if you're not in therapy, then that's all we can do. Okay, let's go on to the next. Okay, so it's now May. So it was February, now it's May. Um, Here for follow up. Feels like depression ebbs and flows, but is managed overall. Is concerned about completing tasks and being evaluated for ADHD. Has a lot of stress with family. Seeing a therapist weekly. So she had really insisted that I start seeing a therapist. So I did, doing everything that this person asked. Patient seen in office for management of depression. She continues to take the Lexapro, which is the only antidepressant she has ever been on. Okay. She's had 3 meetings with a therapist, but they are phone visits, and she doesn't feel like there is a real connection. She said she had tried to find a therapist who was a specialist in blank because she thinks is what her blank have and in trauma. She's struggling with finances and is looking for an additional job. When she's stressed, she binge eats. Her alcohol consumption is way down after moving into her own apartment. She denies suicidal ideation. She describes her mood as okay. She asked again about ADD medications, and I told her again that I would need psych testing to even consider this. I suggested a change to Wellbutrin to see if this helped with the focusing. Multiple stressors, including alcohol and the past history of abuse, are all factors which can affect concentration. Okay, I distinctly remember at this point, I was never asking for ADD medication, as she called it, ADHD medication. I just wanted to be evaluated. This doctor made me feel so like med seeking, and she refused to even listen to me because that's all she saw or heard when I was speaking to her. And you can see it in her notes. Um, I wasn't asking to be quote unquote medicated for ADHD. I still think I may have it, and I don't know if medication is something that I would or wouldn't pursue. I just would like to, it'd be knowledge is power. I would honestly like to know, so that I can help myself function to the best of my ability. But yeah, she wasn't hearing me. It's very upsetting to read. And this had been months at this point. Months of me taking time off work, paying the copays to talk to this doctor who, uh, okay. It is now July 2022, and this is our last appointment. It went horribly. So this doctor had told me, um, I'm not going to I'm not going to treat you for anything until you have like a formal evaluation. So I went and had a formal evaluation, which again was like an expensive process and a lengthy process. And when I came back with a diagnosis, she refused to treat that diagnosis. She refused to recognize it. And in the note, she says, someone I found online, which I did find them online, like through like Psychology Today, which is how I found her. But I'll go through this last note. It's horribly upsetting to me. I have not looked at this paperwork for like 2 years. I've just tucked it away because it just feels so bad to have been treated like this, and it's my life. So our last appointment that I ever had with this lady was July 18th, 2022. Um, okay. Patient seen in office earlier than scheduled because she told the front desk she had been diagnosed with bipolar. I hate that sentence so much. It wasn't earlier than scheduled. I was scheduled. Like, what are you talking about? I didn't like be like, you need to schedule me earlier. I mean, even if I did, that should be fine. But just the language of the way this person talks about me. Anyway, she told the front desk she had been diagnosed with bipolar. I was. I have the second paperwork to go through here. She had been seeing a therapist she doesn't like, Ellen Blank, who is somewhere in Pennsylvania, and she is going to find a new therapist. She also saw someone else online that did ADD and bipolar testing, in quotes, and told her that she had bipolar 2 disorder. I discussed with her how I had reviewed past symptoms with no history of mania or hypomania, and I continue to think the best treatment is consistent work with a therapist. She said she had a therapist. So, the first time I ever met this doctor, like I said, we spoke for like 40 minutes to do my past history. And then after that, it was only a review of how I had been feeling. So she had never really taken the time to see if I had a history of mania or hypomania. She had, be right back. Well, I'll continue. She had made her determinants about me from the first meeting and then was never able to expand on them. Um, so it's very upsetting to me. I understand that as someone who writes progress notes, we do put things in quotes, which it does it looks like quoting sarcastically when that's not always the case, but I'm sure I didn't say ADD and bipolar testing. I did I got a full psych evaluation. Anyway, she said she has a therapist. Her alcohol consumption is social with friends, and she did not quantify. Her mood is good. She denies suicide ideation. She made poor eye contact and looked at her phone throughout the evaluation. Her sleep is good. She then said that I wasn't listening to her and she wanted to leave. We discussed that it would be preferable for her to find a psychiatrist that she felt she could work with and who was associated with a therapist. She agreed. She has 2 months of Lexapro prescribed. I will make another 2-month appointment. She did not want a list of psychiatrists and therapists that we provide. So the reason I stopped making eye contact is because I was just so upset. I was like crying, and she didn't say that. She didn't say I was crying. I wasn't just really like not talking to her on my phone. She upset me to the point where I could no longer make eye contact with her. And that's how it went down. But yeah, I never went back. And I just feel like that whole process was a huge waste of my time. She did prescribe me the Lexapro, which was helpful, but I felt super disrespected and unheard and honestly harmed like throughout the whole process. So, um, yeah, I'll be right back. One moment. Okay, so I had gotten the formal evaluation. Um, in between seeing this psychiatrist, and that the formal evaluation, I had thought I had potentially had ADHD, um, inattentive ADHD, and I met with a expert professional. What is her title? PhD. I don't know what ABPP means, but yeah, I met with this uh, evaluation specialist, and I told her that I thought I may have ADHD. She diagnosed me with PTSD and bipolar 2 disorder. And she said, I can't rule out ADHD, but you need to be treated for bipolar 2 disorder first. So the eval process was lengthy. I was 27 when I um got had this done. June 29th, 2022 is when I had this eval done. I won't go through all of it. But yeah, she did like a whole battery of tests, some different like focusing tests and memory tests, and talking about my background a bit. And going through it, it's like kind of interesting and wild and crazy that I was diagnosed with bipolar 2 from this. Like, we only spoke for some time, you know, but she said I had to be treated for the BP2, and then I went back to the other provider and told her I'd been diagnosed with BP2. She refused to treat it. So it was like very frustrating. Um, and then I found another provider who would treat the BP2. I was prescribed Abilify, which I did find helpful at the time. Um, and then when I went to go back to this provider to say, hey, I've been taking Abilify to treat the bipolar 2 disorder. Can we redo the evaluation for ADHD? She never responded. And I see now, like, that it's been a few years, like, if someone doesn't respond, like, I need to follow up. But I was like, oh my God, she's mad at me. I'm upset her. Because I think there was, like, a little money issue for a bit. And I had sent her an email, like, if my bridge isn't burned with you, can we please meet again and we can finish this? Paraphrasing. I did use the words, if my bridge isn't burned with you. But she never responded. And I think that I took that as the bridge is burned. And I never pursued it any further. So I never I never fully completed the ADHD diagnosis and evaluation. But that person did diagnose me with bipolar 2 disorder, and I did take Abilify for some time, several months. I don't know how long. And I did find it helpful, and I no longer take it. And I no longer take Lexapro. And I'm also not sure if I have bipolar 2 disorder now. I honestly don't know. Um, I say that because I say all this to say I feel a lot better now than how I used to feel. I I used to have depressive funks for long periods of time. I used to have things that honestly felt and looked like mania. I don't know if it was or wasn't. It's hard to know, like a lot of what I experienced maybe contributed to trauma, CPTSD, complex post traumatic stress disorder, and also like not having enough money. I feel like I was always crashing out because I never had enough money to live on, like my young adult years. So I was just like overspending as a response. It doesn't make sense to be that way, but that's how I was responding to not having enough, was by like overspending and like crashing out. Um, so if I have bipolar 2 or not is up in the air. I haven't been medicated for it in um I don't even know how, like a year. And that's part of the reason why I've hesitated to make this video for so long, because I didn't want to be like responsible and be like, yes, I'm not taking I have bipolar and I'm not taking my meds. I don't want to say that because that's actually not even the case. I don't know. I honestly don't know. I had one brief evaluation. I had that diagnosis. I think it would make sense to be reevaluated. I have dealt with a lot of my past traumas, and things aren't the same as they were previously. I also have like I'm just a lot more stable now. My partner really helps me maintain stability in a lot of different ways. We've been together for 3 years now. And when we first started dating, I was like, Danny is the only reason I'm functioning. And if we weren't together, I would fall apart. I thought that I was like still being codependent and could not stand on my own 2 feet. So I was in therapy when we first started dating to like kind of handle that. I was in therapy for a few months, several months, I would say, and I don't think that anymore. I don't think that I am wholly dependent on my partner. I do think that she does help keep me stable, and it is like a rock and steady place for me. But I do also trust in my own stability at the same point. She's just a bit like a pillar for me, you know. Um, yeah. So that whole like bipolar diagnosis was like 2022. I probably was medicated for that for maybe a year, and then Danny and I have been together for 3 years, and then things started to. I mean, yeah, things started to slowly like go on the up and up around that time, and even like the past 5 years, it's been a journey. It's been an ebb and flowing, but definitely the past few years, things are starting to really clear it up for me, and like some of that I attribute to confronting my past traumas, childhood traumas, young adulthood sexual traumas, meeting those, confronting those, opening up those boxes when I was ready. You know, um, some of it I attribute to getting older. Like there was a clear difference up here when I turned, what's the age, 27, 28, when your brain is fully pickled. Yeah, I could feel it for real in like my decision making and the way that I relate to others and the way that I want other people to relate to me. I just feel a lot more secure in that now. Um, yeah, and the way that I love myself has definitely changed. I like myself a lot more. I think I have surrounded myself with people that um, like me, care about me, at the very least, respect me. Whereas before, I was with people that were actively harming me in a thousand little different ways all the time that I wasn't like picking up on. It was really hurting me, but I wasn't able to, um, yeah, like register it because it was just something that I had been used to for so long. Um, so that I guess was what was most helpful for me, and I really feel like I'm on the other side of things now. And I never thought that I could say that, Um, back when things were really bad, when I was in that such a dark place for such a long time, like I never thought I'd feel this light, and I still feel low and at times and sad and grief and struggle. But I just don't. I can manage it better now. Um, I have had my share of crash outs. I will say that I have had my fair share of screaming crash outs where I'm just like, I'm out of control, and that's how I know like there's still some shit I need to deal with because I don't like to be. I'm a very passive person, very mellow, very chill, and there's been like maybe like 5 instances in the past 5 or 6 years where I've just been like coming unglued, screaming, not myself. So everyone has work to do all the time. Uh, that's just how it is. So I'm a work in progress, aren't we all? Um, but to summarize and wrap up here, thanks for hanging in. I'm feeling a lot better than I used to. I used to suffer heavily from depression, from anxiety, from self-loathing, body dysmorphia, addiction, and I think that I have learned to I've just evened out a little bit more. Things have improved for me. I'm so grateful. And I know it can change. Life comes at you fast. Life can really change up on you. And that's just how it is right now. So I just wanted to give an update because, like I said, I had talked about when I was really struggling so badly through my depression. I had been just like talking about it on my channel, kind of like venting or crying or just like coming for support or whatever. So I felt like I owed it to my audience and to myself to do like a little recap on how things have come full circle, and not to be cheesy, but it does get better. It can get better. It did get better for me. Um, yeah, I'm happy to say that. So thank you for listening. And yeah, if you had like commented on any of like my mental health videos and I didn't respond, I'm sorry. I didn't. I really wanted to, but I didn't know how to say it concisely. Like I didn't want to lead anyone astray because mental health is so important. I didn't want to, be irresponsible with talking about medication or any of the decisions I made. So, yeah, that's just kind of like the journey I've been on. Um, Presently, feeling good. Feel like I'm using for any anxiety or like sadness that I feel. I feel like I'm using coping mechanisms or like social supports that are helping me through it, and functioning pretty decently, able to maintain a job. I'm in 3 years at my job now. Whoop whoop. 3 years at my job, 3 years at my apartment, 3 years with my partner. Stable. We're we're locked in, and that means a lot to me. Just having things be the same and constant means a lot to me. So that being said, thank you for listening. Thank you for being here, and I will catch you at the next one. Bye.